Hey there, future nurses. Welcome back to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Today, guys, we're going to be breaking down how to complete your daily focus assessment in under 5 minutes. The goal is to make sure that you guys are able to perform a focus assessment with confidence. I want you to be quick and I want you to be very intentional when you're at the bedside. So let's dive into it right now. We're going to be concentrating on systems. And I'm going to ensure that you are very organized when you enter your patient's room to perform your daily focus assessment. The first thing I want you guys to understand is that patient safety is always first. So as you are entering your patient's room, I want you to be able to focus on patient safety and first impressions. And by that, I mean, when you walk into the room, I want you to be looking at your patient. First, I want you to introduce yourself. That's the first and foremost thing. You introduce yourself as the student or the primary nurse. And then I want you to look at your patient and focus on, is my patient alert? Is my patient comfortable? And is my patient breathing easy? After you have done that, I want you to be able to scan the room for any safety risks, or scan the room to know what's going on and to know if you need to intervene at this particular time. So, as you are scanning the room, I want you to be looking at oxygen. I want you to be looking at IVs. Are they flowing? Look at your patient's IV site. I also want you to be looking to see if the call bell is accessible. Also, is the environment free of clutter? Very important. You want to make sure that you take care of any immediate safety risk. And after you have completed that, then we're going to move on to our first system, which is the neural system. As you begin to conduct your neural assessment, I want you to ask the patient to simply state his name, and then I want you to verify the patient's name on the ID band. After you have completed these things, you're going to move on to evaluating if your patient is alert and oriented to person, place, time, and situation. Remember those four things: person, place, time, and situation. After that, you're going to be looking at your patient's eyes. You want to see if your patient is able to open and close his eyes spontaneously. And then we're going to move on. Hopefully, that you guys have your pen light. You're going to be looking at your patient pupil size and reaction. And then I want you guys to evaluate this. Is my patient's speech clear? The next system would be your respiratory system. Here, you should take about 45 seconds to evaluate. Observe your patient's breathing effort. And is the breathing in this, symmetrical? Listen to breath sounds front and back. I also like to listen to breath sounds on the side. Check your patient's oxygen saturation, and then ask your patient specific questions about their breathing. Are you experiencing any shortness of breath or coughing today? The next system will be our cardiovascular system. And here's where we're going to be checking our heart and the patient's circulation. Check pulses, rhythm, and strength. And you're going to do this on both sides, and you're going to do a comparison. Listen at the apex of the heart. Look at the patient extremities for any swelling, and check your patient's skin color. And again, ask questions about, are you having any chest pain or are you feeling any palpitations? The next system is going to be our GU and GI. 1 minute total it should take here. Here's where I want you to scan the patient's belly. Is it flat? Is it distended? Listen for bowel sounds in all four quadrants and ask when they last had something to eat or when was their last bowel movement. And then I want you to look at your patient's urine. And first and foremost, you want to know, how is your patient urinating? Are they doing it on their own? Do they have a Foley catheter? Or maybe they might have a external catheter like your PureWick. We have one now for male and female. So make sure you are assessing if they have any assistance in urinating. After you have done that, then I want you to look at the urine for the amount, and I want you to look at the color, the concentration of the urine. These things you will have to report out to the primary physician. Our next system will be the musculoskeletal system and skin. Here's where we're going to be actually looking at how our patients move. Are they steady? Are they weak? Or do they need help? Look at pressure points. Look at the patient's heels, elbows, hips, sacrum, and ask the patient if they have any pain or stiffness. Next thing, guys, is after you have conducted your assessment, you gather some data, you're going to have to be able to wrap it all up, summarize it, and put it in an SBAR so that you're able to hand off to the next nurse or to another healthcare provider. And guys, I have shown you or taught you how to do SBAR, situation, background, assessment, and recommendations. And I'll just give you a brief example here. In this particular case, you'll say something like, you give the patient's name, and then you tell them my patient's alert, no distress, background, post-op, day 2, stable vital signs. When you are reporting vital signs, even if you say stable, I want you to give a complete set of vital signs: blood pressure, respirations, pulse, temperature, oxygen saturation. This is very important. You have to chart it anyway, so make sure you have them all. And then assessment: breath sounds clear, bronchi crackles wherever they are, skin is intact, patient has pressure ulcers, or the patient has no pressure ulcers. One or the other. Recommendations: continue ambulations and administering fluids, antibiotics. Guys, that's professional, confident communication. And most importantly, this is how you assess. We're going to assess each system. We're going to start with patient safety first, and then we're going to move through the systems quickly. Remember, you're going to have to assess multiple patients while you are working as a registered nurse. So let's start practicing now. Let's get organized. Let's become confident, quick, and intentional. So just to wrap this up, guy, I want you to realize that every nurse checks their patient, but great nurses assess with purpose. Be intentional, system focused, and be consistent. I'm Dr. Knight. I'm here to help you think, act, and feel like a nurse. Don't forget to like, subscribe, and stay tuned for the next video. Happy clinicals. Don't forget to stay tuned for the next videos. Happy clinicals.